not refuse an episiotomy this year, then you agree. They say no grief anybody, but I tell you, agree for your doctor, agree for your midwives. We are all out here to help you. On this video, I have a very important message for all new moms. Especially if this is your first time of delivery. A lot of women after discharge don't even know what to do. There's a case of a woman where she came for postnatal checkup. 3 days after delivery, it was discovered that the episiotomy cord that was given to her was all loose, and the vagina and vulva area was all opened. And at that point, they had to go in for a second procedure so that her marriage will not scatter. So please, mothers, listen to me very well, because in this video, I want to teach you how to care for any kind of tear on the vagina as a result of delivery, whether it was episiotomy or tear given to you by your baby. You know, after delivery, people come with a lot of suggestion, a lot of advice. They are all giving those advice out of care and concern. But now listen from the midwife's mouth what you need to do so that tear, so that you don't come back like that woman for a second procedure after delivery. 90% of women will experience tear during delivery, but the factor that will determine how fast you recover from your tear is dependent on how you care for your perineum. Number one step to caring for your tear is what? Proper hygiene. You have your bath at least twice a day. Keep the sides clean and dry. When you want to wipe, you wipe from front to back. And the reason is that so that you don't carry microorganisms, particles of feces from the back, like from your anus to the vagina or to the place where the cut is. So you wipe from where? From front to back. And you don't wipe using tissue paper. Why? Because tissue paper can dislodge. It has particles that can stick to the sutures. And when they stick there, they can create a breathing space for microorganisms to breathe. So you don't use tissue paper. Preferably, you use what? Wipes. Don't sit in excess hot water. Don't sit in excess hot water. If the person doing omugo for you cannot tolerate the hot water that she will give you to sit on, don't sit. In fact, if the hot water you will use for your seatbelt cannot be tolerated by your face, when you pour it by your face, it's too hot, don't use it. Use moderate hot water that your skin can tolerate. Then you just add a little pinch of salt. Some people will carry salt and pour. No, the quantity of salt you should put is the same quantity that your taste buds can tolerate. When you put the salt, taste it. Is it what you can taste? Don't put too many salt, it can affect the healing. Of course, this is omugo period. You eat balanced diets. You eat your vegetables, you eat your fish, you eat your mangala, you eat your meat. In fact, you eat well balanced diet, food rich in protein and vegetables. They will help in the healing of the wound. My dear, take time to rest. It's not a period of too many activity. When you rest, you take time to build your immune system so that everything that has gone, that has been altered in your system can be repaired to come back to normal functioning again. Avoid sex until you are sure you are properly healed. We don't want a situation where after delivery you come back that the stitch is moving, So avoid sex until you are sure you are healed. But it is not an excuse. Some of you will heal and will be looking at you. Please, it's sincere. When you are sure you are healed and okay, let the activity continue. If you notice any abnormal sign, for instance, you begin to notice abnormal smell, discharge, pulse, redness, pain, anything abnormal, please come to the hospital so that you can be reviewed. Don't do self-medication, okay? And also, don't fail to take your postnatal medications. Some people feel, I've delivered, no need for drugs. My dear, you see, those drugs are still very important. Don't fail to take your medication, especially your antibiotics, your multivitamins. They are still very, very important, even after delivery. And of course, like I said in my previous video, the perineum is the center of all activity. So please practice Kegel exercise. It helps to strengthen the muscles of your perineum and then enhance fast healing. For more information on Kegel exercise, the link to the video will be on the description box. Please do well to watch that video, okay? To manage pains from an episiotomy or tear, these are the few things you need to do. Number one, you can use ice pack. It's not the time that you'll carry hot water and be pressing for. When you press too much hot water, you know what happens? The blood vessels around that area dilates. And then there'll be more blood supply, which will cause more edema. And then when there's more edema, they will press on the surrounding nerves and then increase pain for you. So what you need to do is what? Ice packs. Of course, sit bath. I just explained how you can do your sit bath. Sit bath with moderate water and salt. And then you take pain relief as prescribed. Don't do self-medication. And finally, sit on a comfortable, fluffy, comfortable chair and enjoy this face, okay? Remember, you're not supposed to be suffering and smiling in this face, because the gift of God maketh rich and added no sorrow. So I assure you, if you follow these few steps and tips of mine, you're on your way to a happy, smooth postpartum period. Till I come your way again next time, I remain Nazi. And if you are yet to subscribe to my YouTube channel, please, what are you waiting for? Subscribe and click on the notification bell so you'll be the first to get notified each time I post a new video. See you again next time. Bye.